Okay, ladies and gentlemen, most importantly, you need to know the type of landmarks that we expect to find in an acceptable extraoral radiograph. Ne? So this presentation under Unit 20 just shows you guys pictorially actually the type of anatomical landmarks we expect to see, as well as where they are located. Okay, so please familiarize yourself with this. It will make your life much easier. Okay, try and correlate this with all the anatomy that you guys have learned since last year. It will make things easier, because once you know the anatomy, you can just extrapolate that information and keep that same energy on your radiographs. Okay, so that's essentially what's happening here. And then from there, okay, they're just showing you more anatomical landmarks being your lingual foramen, and then from there your genial tubercles. So these are some of the things that you will be able to distinguish on some radiographs, be it digital as well as film radiographs. Okay, and then the same thing applies with the maxilla. These are some of the anatomical landmarks, like your tuberosities, your mastoid processes, your external auditory meatus, and so on and so forth, that you might actually encounter in the process. So you have to be able to identify them, so that you know, obviously, if maybe you do not find said landmarks, you know that maybe more than anything your patient positioning was not correct. Okay, so then you'll know that, okay, if I'm not finding said landmarks, what did I do wrong? How do I correct myself going forward? Sometimes, be it patient positioning or over as well as underexposure, is actually quite common, especially with film processing. Ne? So from there, okay, this is an example of an incisive foramen. This is normally found anatomically between your two maxillary central incisors. So those are some of the things that you need to be able to distinguish. Ne? So that's essentially what's happening. Know both the maxillary as well as the mandibular for landmarks. Okay, so correlate all of the landmarks that have been identified below to the X-ray that has been provided above. I think that's very self-explanatory. Ne? Sharp.